1 in 5 children in Singapore has asthma. Many are not aware that asthma can be life-threatening if not managed properly. I'm Dr. Mohana Rajakulendran, a pediatrician at the Parkway East Paediatric Clinic. In this episode, I'll share more about the different types of asthma inhalers and how to use them correctly. The two types of medications which are used in the treatment and control of asthma are your controllers and relievers. Controller medications are low-dose inhaled steroids, which act directly on the sensitive airways in asthma to control long-term inflammation. The dose of the medications is adjusted once the asthma is under control, and these medications help in preventing severe asthma attacks. Most children are able to wean off these medications over a few years and may outgrow their asthma by the teenage years. As the steroid dose delivered is minimal, there are often no significant side effects to worry about. Inhaled steroids have been shown to be safe and do not affect the growth potential of young children to any significant extent. Reliever medications, more commonly known as ventolin inhalers, are required to relax the narrow airways during an asthma attack. They work quickly to make breathing easier during an acute attack. I will now demonstrate the use of the ventolin inhaler with a spacer and mask device. Use of a spacer and mask device is required in young children and avoids the need of coordinated deep breaths to deliver medication effectively into the airways. The use of a spacer device with your inhaler medication is simple. Remove the protective cap from the puffer, shake the inhaler well, and prime it by pressing down a few times until a mist comes out. Insert the inhaler firmly into the end of the spacer. Place the mask over your child's face and make sure that it covers the mouth and the nose. Try to get a good seal on the skin so that no air can get in. Ask your child to sit upright and breathe out gently. Hold the spacer and inhaler level so that they do not tilt up or hang down. Press the inhaler once to release a dose of the medicine into the spacer. Do not remove the puffer. Allow your child to breathe in and out for 5 to 6 times. If further puffs are needed, shake the inhaler again and repeat the steps. You can shake the puffer while it is still attached to the spacer. I hope this video has been useful for you to identify the types of medications required to control asthma and relieve acute symptoms. With the knowledge of how to control asthma better, I hope that both you and your child will be able to breathe easier.